Good morning, Dr. Manesh.
Thank you for coming to our office to talk about your experience in our office.
You're very welcome. Glad to do it.
How did you find us?
I was referred to you by my dentist, Dr. Marr, at Rancho Miguel.
What was the reason you were referred to us?
I had a tooth that I had lost that was actually extracted before I came to you, and there was some bone loss and a bone graft that was done, and I needed to have that tooth replaced.
And what were the options to replace that tooth?
Dr. Marr, when I was at his office, generally talked about a crown and as being one option and an implant as being another option, and he was sort of strongly in favor of getting an implant as opposed to a crown because of the where the tooth is located.
Have you had an implant before?
I had not. I had a crown previously, but I had never had an implant before.
And did you know what materials implants are made of?
I generally knew that they were made out of metal, but I didn't know what type of metal.
So you were introduced to zirconia implants in our office?
That's right. The first time I had learned about them was in this very chair in your office.
And how did you feel about zirconia implants?
We had talked about the one-piece aspect of an implant and about the material and about the tissue compatibility, and it seemed that there were a lot of advantages to getting an implant. And after hearing you speak, it seemed like a pretty easy decision to go with a zirconian implant. What
was your experience during and after surgery?
The surgery itself was not anywhere near as difficult as I thought it would be. It was relatively easy, and comparatively, when viewing the extraction, it was far less painful, and there was much less discomfort than the extraction.
Did you know about all of the advantages of zirconia implants that we discuss in our office? Some of the advantages that I can talk about are that the zirconia implants are metal-free, and zirconia is more biocompatible. Therefore, there will be less inflammation and less bone loss around zirconia implants in the long term. Zirconia implants are one-piece versus two-piece titanium implants. And one advantage of having one piece is that when the junction between the abutment and the fixture of the implant can create a little micro gap where bacteria can be accumulated, and thus creating inflammation and bone loss. What was the impression or the feeling of your dentist about zirconia implants?
He was very pleased when I went back to his office. He was very, again, pleased with the outcome, and I think the implant made his job relatively easy in terms of taking the impression and getting the crown made. And you know, we had talked about it after. He was happy with the way that the tooth looked and the positioning of the implant, and you know, overall, I think he was very impressed.
Now that you have a crown placed on the implant, how does it feel?
Feels just like my tooth felt before I had it extracted. It feels like it's been there forever.
And you have your smile back again.
I do, which is great. So that's
So Craig, let me show you on this screen, on the radiographic image of your implant, what a zirconia implant looks like. The implant that you had done is a one-piece implant. You can see the fixture part of the implant that's in the bone in this area, and then there's the abutment part of the implant, and it's all one piece. As you see, there is no junction between the abutment and the zirconia and the fixture. And this is the crown. It's an all ceramic crown that was placed on the implant, so it's completely metal-free. The zirconia implant is metal-free, and your crown, final crown, is metal-free. And this is in the front area of your mouth. So one advantage of zirconia implant is that it's white. It doesn't show a shadow, a metal shadow, a dark shadow when you smile through the gum. And there are no metal edges, margins on the crown because it's all ceramic crown. There's no metal in the crown. And as you can see, there is an emergence profile on a zirconia implant where you don't see it on a titanium implant. And that emergence profile looks like a natural tooth. And that creates a natural look on the implant, and it prevents any foot trap. With the titanium implant, it's cylindrical and there is no flare-up, no emergency profile, and you tend to have foot trap in the corner of the implants. And another advantage is that the gum between the teeth will fill in around the zirconia implants, whereas in titanium implants, because it doesn't have the emergence profile, it may not fill in and it will create a little black triangle, whereas you don't see that black triangle, you don't see that gap between the teeth with the zirconia implants. So these are some of the advantages that you can actually see on a radiographic image as well. And in long term, this is the best way to go to replace a tooth. Do you have any questions on these?
I don't. Again, I'm very pleased with the outcome, and it's nice to see it on the screen.